Here's what you need to know if you are providing care to a patient on CRRT. As a quick overview, dialysis works by the concurrent movement of blood and the dialysate fluid across a semi-permeable filter. This creates a diffusion gradient. As the fluids move past each other, there is an exchange of toxins across this gradient. The toxins are extracted as waste and the purified blood is returned to the patient. CRRT is preferred to intermittent hemodialysis when patients are hemodynamically unstable because CRRT filters blood at about half the rate of intermittent hemodialysis. CRRT is continuous. Ideally, it runs 24/7 without interruption, which means all other aspects of your patient's care will be affected. Let's start with medications and CRRT. The type of medication, the diagnosis, the degree of illness, the type of dialysis filter used are just a few of the considerations for how we use medications in CRRT. Medication dosing is not a one-and-done deal. It has to be re-evaluated as the patient condition either improves or worsens with CRRT. Antibiotics, anticonvulsants, vasopressors, analgesics, and sedatives are some of the most critical meds that must be continually assessed for patients on CRRT. Your best bet is to run all medication changes by your hospital pharmacist. The next thing to monitor is clotting. Anytime blood makes contact with foreign objects, including the tubing and filters of the dialysis machine, the coagulation cascade is activated, leading to formation of blood clots. We use either heparin or calcium citrate as an anticoagulant to minimize the risk of clotting. Monitor for visible clot formation, which is most common during the start of CRRT. This takes us right to the risk of bleeding with CRRT. Anytime anticoagulation is used, there is an increased risk of bleeding. Here's what to monitor: your hemoglobin, hematocrit, platelets, and APTT for heparin use, and of course, any visible signs of bleeding. Next up is temperature regulation during CRRT, specifically hypothermia. Body temperature is strictly regulated around 98.6 Fahrenheit. During CRRT, blood is being removed from the body, ran through a machine at room temperature, and returned to the body, all of which drops the temperature of blood. In a patient who is already very sick, hypothermia can increase oxygen requirements, cause arrhythmias, ischemia. Overall, it increases morbidity and mortality. Most protocols will recommend hourly temperature checks, advancing to continuous monitoring if temperature drops below normal. There are blood warming devices, external warming blankets, heating pads can also be used to raise the core temperature. Head over to pharmacology.com for 2 more key monitoring parameters in patients receiving CRRT.